What do a hot dog, a coin, and a tiny bouncy rubber ball have in common? They're all choking hazards. They are also things that are likely to be found on the ground where the baby crawls. The baby who is biologically programmed to put everything in his mouth. If you can see where this is going, you're right. More than 60% of choking episodes occur among children younger than 4 years of age, though choking is a leading cause of injury and death for all children. It's important for us to be prepared, just in case a child near you puts the wrong object in their mouth.
I always recommend that parents should take some sort of CPR course prior to giving birth. Hopefully they'll never need to use it, but it's a very essential knowledge that might come in handy.
The universally understood sign for choking is when someone raises their hands to their throat like this. Small children probably don't know that, so you have to look for other signs.
If you see that your child is choking, I want you to approach your child, and if he's coughing and he's moving air, you do nothing and you let him work it out. There's nothing to be done if the child is coughing and moving air.
If a person cannot cough, speak, or breathe, he needs medical assistance immediately. If there's any concern, the first thing you do is call or tell someone else to call 911.
If, on the other hand, the child is not moving air and there's no sound coming out of the child's mouth, you go behind him and you give 5 back blows between the shoulder blades. If he's still having a problem, then you could engage in the Heimlich maneuver, which many of us have learned with adults. It's very similar in a child. You go behind the child, take your fist and put it underneath the rib cage, and take your other hand and put it over your fist, and you push up and in. And hopefully whatever's been lodged in the windpipe will come out and the child will begin breathing again.
All children should be seen by a doctor after choking, even if the object is removed. Tiny pieces may have been inhaled into the lungs, which can cause complications. If the Heimlich maneuver was necessary, you should take the child to a hospital emergency room to be examined for airway damage. The Heimlich maneuver is not recommended for children younger than 1 year of age.
With an infant, it's a little bit different. You would take the infant and put her face down on your lap with the head slightly slanted downwards, and you do 5 back blows to the back of the child in between the shoulder blades. If the obstruction is not cleared yet, then you flip the child over, and again, the head slightly facing down, and you do some chest compressions with 2 to 3 fingers in between the nipple line, and you press hard 5 times also. Hopefully that will clear the obstruction.
It's good to know what to do in an emergency, but the best scenario is to make sure it never happens in the first place. Routinely check for small objects in any new setting, particularly at play dates or arenas that cater to small children. Round objects are the most dangerous, but things like deflated balloons, foam that expands with moisture, and button batteries can cause serious injury.
You should get down on the floor, crawl around the house, and look for all of the small items that your child might put in his mouth. There are things all over your house that you might not even realize are there that could potentially be a danger, that he could put in his mouth and he could swallow and choke on. Especially when you have an older child that has small little toys that are age appropriate for your older child. You got to start getting those up high.
The most common cause of choking in young children is food. Hot dogs cause more choking deaths than any other food. Other high-risk foods include candy, especially hard candy, meat, seeds, nuts, and popcorn. You can't stop your child from eating, but you can insist they sit while eating. Avoid round, firm foods, cut spherical foods into quarters. It's a little tedious, but there are 2 upsides. 1, no choking. 2, most kids like eating foods cut into fun shapes. Triangles over squares, right? I'm Dr. Allison Suarez, and you're watching the eHealth Network. See you next time.